Hello and welcome to today's virtual information session on how to care for an aging loved one. My name is Beth Styler and I will be your moderator for today's webinar. This virtual event is brought to you by Geer Village, The Lodge, Senior Living Community in Canaan, Connecticut. Today's webinar is being recorded and once available will be emailed to you. Our presentation today will feature Dr. Joan Roach and Deb Pelletier, Geer Village Senior Community Admissions and Marketing Coordinator. We will be saving time for your questions towards the end of today's webinar, and we'd really like to hear from you. Anytime during our presentation, please type your questions into the Q&A panel available through Zoom at any time during the course of the webinar. Our presenters will do their best to get to all of your questions. So at this point, I'd like to introduce Dr. Joan Roach. Dr. Joan Roach, PhD, RN, has 40 years of professional experience serving and advocating for older adults. She's been a gerontological clinical nurse specialist for a major healthcare system, an associate professor at the University of Massachusetts College of Nursing, a healthcare consultant, and a family caregiver for her entire adult life. Dr. Roach, welcome.
Welcome to everyone. Appreciate you joining us, and I want to thank Geer Village for everything they do for our seniors and for sponsoring this webinar. Today, we're going to talk about an aging journey, and we're going to talk about the people who go through it and their caregivers. And Beth very graciously is going to move each slide, so you'll hear me ask her each time. Here we go. This is what we're going to talk about today, how to recognize the signs of deterioration, kind of knowing about how housing models relate to aging, what assisted living is, talking about dementia caregivers. And for some people, it may be important to look at ways to afford senior living. And then how to determine what you need and how to talk about it. Now, next slide. You heard Beth mention that I'm a nurse, which is my first credential. And then after that, I studied gerontology. And then I became a PhD and worked on research. And the one thing that is not mentioned in this is that I am now on the journey myself, and I have helped many of my own family members through this journey. And it is a journey. Some of you may have heard about the golden years, and you might have heard all kinds of different things about the golden years. And you might sit back and say, I don't know how golden they are. The good news is that we are living longer, and we are living longer with more health fulfilling opportunities available to us in those later years. What they did not tell us is as we aged and go through this, we would not have our 50-year-old bodies. So the senior citizen who is going through the aging process has some normal things that are going on. When I studied gerontology, I found that it was very discouraging because many of the classes were about everything we lose: bone density, muscle mass, memory. There are issues that are a problem. What we really need to do for those of us who are on the journey and those who are working with people on the journey is to make the most of what we have. Next slide. So my career, after I studied about all those horrible losses, has focused on what is there and how we can maintain it and optimize it rather than focusing on what is missing. Next slide. You may have seen this in many places. There's a lot of times that you see 8-ounce glass with 4-ounce glasses of liquid, and some people say it's half full. Some people say it's half empty. And the psychologist used to believe that that was a personality characteristic. But now the commonly held belief is it is a choice. Next slide. And the thing is to choose what we can do, which is very important. Now, one of the first points that I was asked to talk about is how to recognize the signs of deteriorating health in one of our loved ones. I could give you all kinds of things to look for, but the reality of it is slowing down, walking slower, having some balance issues, maybe having some memory issues. Those are normal aging changes. What is not normal is depression, It is not normal to withdraw from things we love or not engage in our lives. Now, I do want us to have a little aside here that sometimes when a couple has been together for many, many years and one member of that couple dies, it is not normal, but it is common for the surviving spouse to sometimes have a period of depression. I will remind you that that depression is treatable, and if you see it in your father or mother who is a widow or widower, it's good for them to get treatment early, and oftentimes after a little time with some good treatment, possibly some medication and maybe some counseling or a grief group, can really move on. Depression is not normal. If you see your loved one in a state of depression or you see them not doing the things they enjoy, it's a sign that you need to intervene. Now, one thing we didn't talk about is I spent much of my life being a caregiver, and I took care of people who had very engaged lives from a distance. My aunt was in Chicago, I was in Massachusetts, my mother-in-law was in New Jersey, and I regularly checked in with them and then went to see them. And I had a little simple thing that I would do. I wouldn't say, did you go to church? Because church was something they loved. I would say both to my aunt and to my mother-in-law, who did you see at church on Sunday? And one week someone would say, oh, it was raining, I didn't go on Sunday. Well, that's reasonable. Next week, ask the same question. And my mother-in-law might say, oh, I didn't wake up on time, so I didn't go. Okay. Third week, ask the same question. Oh, I just didn't feel like going. 3 weeks in a row, I'd get in the car. I would drive to see her. And sure enough, something was a problem that she needed to be attended to. Maybe it was her back and she needed to check in with her back doctor. Maybe her heart medications needed tweaking. Whatever it was, she needed some attention. And it was because that is not appropriate. And then when she get back engaged again, we knew things were going well. Next slide. Now, you say, my philosophy is to focus on what is there. The important thing that we want to think about is how we can enhance what does exist. And the single most important thing that all of us can do, not only seniors, but soon to be seniors and young people, single most important thing that we can do to make the most of our health is physical exercise. And this 150 minutes a week, 5 days a week, 30 minutes is what is recommended. It's recommended that it be moderate to vigorous intensity physical activity. But what's really important for seniors is it needs to be senior-friendly physical activity. It needs to be overseen by someone who understands our bodies and each of our individual ages. When you go to a really good, well-run exercise class for seniors, you will see some people sitting in chairs, some people standing, some people holding onto a chair, other people not holding onto a chair, because we all have different needs. But we are using all the muscle groups in all of our body, and we're using them repeatedly, gently, so that we do some stretching on all of our muscles and keep them in the best shape possible. The research does show us that light to moderate alcohol consumption is a good thing to do. In women, that's up to 1 drink a day. In men, it's up to 2. People always ask me about diet, and the research that exists, although there isn't a lot, indicates that a very prudent diet is valuable. And the one that is highly recommended is the diet intervention for neurodegenerative delay, which is a combination of the Mediterranean diet and the DASH diet. Basically means eat less red meat, more chicken and fish, eat more fruits, more vegetables, a lot of those berries. You eat more olive oil rather than butter, and you minimize the sweets and the refined carbohydrates. It doesn't mean you eliminate them completely. Instead of eating a piece of cake at breakfast and another one at lunch and another one at dinner, you might have a cookie after dinner. Whatever it is, you moderate. The second intervention that is really strong is social engagement. Now, I don't know if any of you are researchers, but none of this research includes randomized controlled trials. All of the research that I am referring to looks at huge numbers of seniors. A very common study that you may be familiar with is the Framingham Healthcare Study, which looked at nurses, and they were checked on over about, I think it's almost 30 years now. And they would look at each of these things and see how, break the participants down into two groups, those who exercised and those who didn't. And then they'd look at the difference between them. For instance, we know with exercises, those who exercise have less progression of memory disorders, they have less chronic diseases, and they live longer. And the same is true with social engagement. So people that have social engagement on a regular basis versus people who are isolated they live longer, they have better health outcomes. Both diabetes and cardiac disease are better in people who are socially engaged than people who are not socially engaged. And there's a much larger incidence of depression in people who are socially isolated versus those that are engaged. So it's a very important thing that needs to be part of all of our lives, and it's something that we really need. And I think we all recognized it last year, because in 2020 with COVID, I'm sure you know someone who had an experience where they felt really isolated, and they have had health and mental health problems afterwards. Non-smoking is still considered to be the way to go, and that's not a surprise to you, but it's a good example of the kind of research we've looked at. Because the reason we know that is we look at smokers versus non-smokers, and we can see the difference in their outcomes. Most of this presentation is based on the research that exists in terms of maintaining health for seniors. And I like to add some stories because I feel that that really helps a lot for people to remember things. Next slide. So, social isolation kind of leads us to something, which is where we live may have a lot to do with what our outcomes are. And I'm talking about general models of housing. Now, most people I know, many people I know, kind of always assumed they would just live in their house for all their life, and that was what they wanted to do, and they'd figure out how to make that work. It's understandable. Most of us either built or bought our own home. We decorated it. We filled it with all of our stuff. And we like to be surrounded with our stuff in this setting that we have arranged. It is understandable why people love being at home. One thing happens as you get older is our home is a building. That building has a roof. It has grounds around it. It has walls that need to be painted. It has heating and cooling systems. It has plumbing. All of those things require effort. Some of that effort are things that we do when we're younger and we often enjoy. I was a gardener for most of my life, and I always enjoyed doing the weeding. Now I'm hiring people because it's harder to do. And what happens as we get older, with our bodies slowing down, sometimes we reach a point when we're living in our house and all of our energy is going into taking care of our bodies and our house. And when the burden of caring for your home is greater than the pleasure you get from it, you think, wait a minute, this isn't what I signed up for. And that is the first step where independent living can be a huge help. Independent living is residential style apartment living in a nice setting where you can move into an apartment, pay monthly rent, and bring your furniture, and you live there. There's social activities, there's transportation, there's meals, there's all housekeeping, there's access to people, so there's social engagement right there. And all of that stuff that has become a burden, the roof, the grounds, the repairs, the painting, is taken care of by the senior community. So living in independent living is really very much like living at home, but you no longer have the burden of building maintenance. That's all managed, and you have right in your home activities and friends. Now, we live in New England. And you might say, well, I have a very active social life. I go to exercise class, I see my friends, I do all these things. Or your parent might be that way. But what happens, we all know in New England, there's a good number of days during the winter when you get up and you look out and you think, I don't want to drive. Or maybe some of us get to the point where our vision at night isn't as good, so we start withdrawing from nighttime activities. If you choose to live in independent living, those activities are right in your building. And if you need to go somewhere, let's say the grocery store or the doctor, you want to go see a play, transportation is provided for you right in the building. Now, next step along the journey, many of us do well in independent living. And then, in addition to taking care of that building, the house, we have to take care of the body. And taking care of our bodies is really called activities of daily living. And what that means is keeping our clothes clean and dressing, preparing our food and eating, taking care of all of our toileting needs, making sure we get our medications, taking care of what makes us healthy so that when we go out into the world, we feel really good. And one thing that does happen as we get older is some of those activities get more difficult. And people then need help with what we call activities of daily living. A common one that starts is people might have balance issues and they have a hard time moving around, or maybe they have a hard time taking a shower because they're afraid they're going to fall. And so they start doing that less. In our case, I'm 75, my husband's 75, he's supposed to wear TED stockings. And he can't put them on by himself. He has tried every one of those little plastics things and all the gimmicks that they gave him when they gave him his TEDs, and they don't work. So I need to put his TED stockings on. That means he needs help with one activity of daily living. So people sometimes get to the point where they either are living at home or they're in independent living, and they no longer have to, let's say they no longer have to take care of their house or the lawn or whatever it is, but they still have to take care of the body. And that becomes more difficult. And that is where the need for assisted living comes in. Assisted living is residential. It's a lovely apartment that is, you bring in your own furniture, you hang up your own pictures, you arrange it the way you want. If you're already living in independent and you happen to have been really smart and you chose a community that has both levels of care, then you can move from independent to assisted, and you know all the people and everything goes smoothly. What you get in assisted living is a licensed level of care that's licensed by the state, so it's overseen, and it is secure in terms of the employees are required to have criminal records checks, for example. And that's one of the reasons that licensure is really valuable. And in that setting, there is a nurse who is there, who is an assisted living nurse, and that assisted living nurse evaluates each of the residents in the assisted living to see what they need. So Mrs. Jones in apartment 2A needs help with dressing, and she needs help getting to breakfast every morning. And she likes to get up early, so the aides go and see her at 7. And Mr. Smith in the next apartment, he likes to sleep a little late, but he needs medication management, so they don't come to his apartment till 9. So it's all individualized, and that assessment is completed on admission, and it is completed and updated if there's a change in the person's health, if they have a medical episode, if they have a surgical episode, then there's an assessment to make sure they don't have additional needs. If things are going along smoothly, there's an assessment that's done every 120 days. So not only are the burden of taking care of the building taken care of, but all the burden of those daily activities. So you can enjoy going out and going to an exercise class. You can enjoy, because it's right in the building, you can enjoy an activity or an evening of music that's happening right in the building. You can go and sit and talk to your neighbors about current events in the morning, because that's all happening right in the building. And you don't need to worry about transportation. If you live in assisted living or in independent living, yes, you may keep your car, but you don't have to use it all the time, because transportation is available to things like the grocery store, to like the doctor, and to different events, concerts, whatever happens to be coming up in the community, or just a lovely drive to see the leaves. Now, the next level of care, there's actually two more levels. One is if a person requires very specific, secure memory care, then that's another level that is important for people as they age, because none of us know who's going to go down that path. And then some people require additional physical care, either because of an illness, maybe they have a feeding tube, or some kind of intervention that by the license has to be done in a nursing home, or maybe they can no longer really get around much at all, and they become what we hear as bedbound, which means they need two people to help them get out of bed, get into the chair, and move around. And those require nursing home level of care. The reason we're talking about all of this is that back a little while ago, I talked about everybody wanting to stay in their home. But as we go down this journey, some of us realize that we reach a certain point where we can't get enough help at home, and we want to move to a different place in order to call our home. And there are all these different levels. I highly recommend that when you go to make that move, you consider moving to a community that has multiple levels of care. One thing you don't want to do is find a lovely independent living place, move in there, and then you need assisted living. There's no assisted living, and you have to move to another community. So that's one of the reasons we talk about all of these levels. Next slide. Now, assisted living is probably the one that is most specific, and it might be new to some of you. And I talked about those activities of daily living, which is assistance in bathing, dressing, and grooming. In addition to that, these are the other things that are available in assisted living. I want to spend a minute talking about medication management, because it's very important that you understand what medication management is. And medication management means that the trained staff in the assisted living community will help a resident take the medications that were prescribed by their doctor. This does not mean that someone comes in and changes the prescription. What it means is they enhance the relationship. You may not be aware, but many people are prescribed, as they get older, a lot of medications. You reach a certain age, and the average senior's got 7 meds. You reach another age, and the average senior's got 14 meds. That's a lot to keep track of. They're ordered for morning, noon, and night, before meals, after meals. And if you've ever tried to fill that box that's got the 4 levels and the 7 days, it's hard to fill, much less hard to take medications from. And what actually happens to very many people is a doctor who knows them will prescribe a medication regime, and people go home and they don't follow it. Sometimes because they don't want to follow it, but sometimes because it's too hard and complicated to follow. So what medication management is a trained healthcare personnel comes in, looks at what's prescribed, and comes in at the times of the day that you're supposed to take them, and make sure that the individual takes them. Some people, they can walk in the room, and sometimes the people will say, I don't really want to take that. So what the healthcare personnel does in typical assisted living, they bring in the nurse, they talk to the family, they talk to the doctor, and they say, Mrs. Jones has been prescribed this medication and you don't want it. I do want to highlight there is a feature that Geer has that's very unusual, which is they have an on-staff pharmacist. And in addition to the nurse, they can have the pharmacist review what the medication regime is. But before they make a change, they contact the family and the doctor, and they speak to the doctor and they say, Mrs. Jones had this prescription. She really doesn't want to take it. Would you consider changing the time, or changing the dose, or changing what the medication is? So the whole purpose of medication management is enhancing the relationship between a senior and their physician. It is not about interfering with that relationship. And so it's a really valuable thing. And 50% of the people who are in assisted living need medication management. It is a skill that many people need, even people who don't have a dementia or a memory care disorder. Then there's things like emergency call systems, 24-hour security and staff available, which very few of us have in a really great way in our homes. Some of us have modified that and have the life alert type things. We got one of those for my aunt. And when my cousin and I called her and asked her how she liked it, oh, I love it. And we went to visit her. It was sitting on the counter. Well, of course she loves it. She wasn't even wearing it. A life alert system of any type or emergency call system is best when it's used by the residents. So the type that is worn on the wrist that people can use at any time is really valuable. Then there's things like 3 meals a day, housekeeping services, and laundry. And I can tell you, I'm ready to sign up for that. That's really makes life very valuable. And then those social engagement opportunities with social and recreational activities and great exercise programs right in the building. And some of you may or may not know that Geer has built their building in cooperation with the YMCA. And so it's available right there with a pool and great exercise programs. It's really terrific. And again, it's important to consider a community that also has Alzheimer's and dementia care that is specialized in the building. Next slide. So why would I be talking about this? And I am talking about this because going to a senior living community is a way that you can have senior-friendly physical exercise, nutritious meals, safe social engagement, learning new things, and cognitive exercises right in the building. We all want to do things, but it's very hard to do at home. So it's a way of enhancing things. I do have to comment, I've been doing this for 20 years. And last year was the first year I had to put safe social engagement on there, because the idea of that there's a community that is paying attention to make sure that as we have social engagement, we're not in contact with anyone who's going to bring any kind of sickness. Next slide. I don't know about you, but pretty much everybody I know has had a worry at some point about memory loss. Maybe you have trouble, misplace your phone, your keys, your glasses. And first of all, the good news is that there are normal memory changes. Our brains were not designed to really do multitasking. When we're younger, we do something that looks like multitasking, and we do multiple single tasks at a time, and we get along okay for whatever reason. But our brain kind of resists as we get older and says, you're going to do one thing at a time. And our brain has the ability to focus on more important things rather than unimportant things. So for example, you may have ever watched a really good movie and the next day you're talking to your friend and you can't remember the name of the actor who was in the movie. You still don't know the names of your children, the names of your siblings, the names of your coworkers. So the brain hasn't allowed us to engage that unimportant area of names, and they're stored in a different place than the important names are. And so that is kind of a little bit about what the normal memory changes are. Now, there are also memory changes, and most of the memory changes from dementia do relate to Alzheimer's disease. I do want to tell you that there are many dementias. Dementias are diseases that affect the brain's ability to function, and they do happen later in life. The reason we talk about Alzheimer's so much is 60% of the dementias that exist in senior citizens are the Alzheimer's type. In addition to that, there are about 6 other dementias that each comprise anywhere from 5 to 10% of the amount. The other dementias don't always start with memory loss. They start with other cognitive losses. For instance, Lewy body disease is one of the dementias, and it starts with what we call changes in executive function, which is your ability to make decisions and process things changes. So that person won't have memory lapses, but in fact, they're having trouble writing their checks, or they're having trouble following instructions, or the kinds of things that they've always done well, they have difficulty with. So, and then there's other types of dementias as well. There's vascular dementia, and that can have all different manifestations because it depends upon which part of the brain was damaged by the vascular damage. But Alzheimer's is the most common, and it does start with recent memory. Probably the biggest challenge for somebody who's encountering Alzheimer's in a family member for the first time is that they have a really hard time with very recent memory. But you can go back many years and their memory is great. And it is lost in reverse chronological order. So you start by not knowing what you had for lunch. And then pretty soon you don't know if you ate lunch. And then pretty soon you don't know what time of day it is. So those are the kinds of losses that happen, and they happen over time. The development of the dementias is something that is very gradual. It doesn't happen overnight. The normal memory loss is very gradual. It doesn't happen overnight. If someone you love or anybody you're close to, a friend, a neighbor, a relative, wakes up one day or over the course of 24 to 48 hours, all of a sudden they become completely confused, disheveled, they're not themselves. That is not sudden onset dementia. It is not sudden onset memory loss. That is called acute confusion, and it is usually related to something like an infection. Urinary tract infections are very common for this. It can be taking the wrong medications. The thing that's important about it is if you see that, get them to good medical help as soon as possible, and make sure you tell whoever it is, the hospital or the doctor, this person is not normally confused. So it's a lot to go over in a short period of time, but it's a good introduction. Next slide. You want to know the single most important thing you can do to delay or prevent cognitive changes? Physical exercise. The good news is it's easy for all of us. Exercising 5 days a week is good for everybody who's a senior. It's also good for everybody who's not a senior. And it is the best way to strengthen cognitive ability. In fact, cognitive exercises work best when there's physical exercise combined with it. Walking can be plenty. It doesn't need to be too vigorous. It does need to be supervised well by someone who understands the senior body. Next slide. Second thing that is the most important for someone who has a dementia is socialization. It delays the process of Alzheimer's and other dementias, lengthens life, and helps in combat chronic disease. That includes diabetes and cardiac disease. And isolation is associated with more rapid progress of all of those problems. I read that word for word because it is so important to think about. And everybody thinks about taking a medication or going to physical therapy, but they don't understand how important it is for basic social contact. And cognitive exercises, the ones that are best are the ones that are in a social context. Playing a game with another adult. The little cognitive games that are on your phone and on your iPad are not the best cognitive training things that people have. They're okay, but they're really based on speed. Engaging with someone else and having a conversation about something that may be new to you or explaining something out of your own life is a way we use multiple areas of our own brain, and lots of sections of neurons are firing. And the more we use them, the less likely we are to lose it. It allows us to learn new things, and it's a wonderful way to work. Next slide. So I talked to you about normal memory changes, and I talked to you about some of the changes that relate to dementia. And you might be sitting there and saying, well, I don't know if these are normal or not. And you're not a trained therapist, so it's understandable that you wouldn't know if they are normal or not. So if you're beginning to wonder, are these changes maybe more than the normal changes? You compare yourself or your loved one to other people their same age, and maybe they're more forgetful than other people. And maybe they start forgetting things that are really inherently important. One of my doctor friends used to say, if you misplace your keys, it's probably normal. If I hand you your keys and you don't know what to do with them, that means there's probably a problem. So my suggestion is, if you're beginning to wonder if this is more than normal memory changes, it's really important you get a good evaluation with either a neurologist or gerontologist or a good team, and they can start moving you along the path. They may not have a diagnosis right away. You might have to come back in 6 months. They will probably do some blood tests and probably do some scans like CAT scan. However, those will not be able, in many cases, to identify. Sometimes they can identify a vascular dementia or maybe a Lewy body with a scan, but sometimes the blood test will find another thing that was causing the person to behave abnormally. One thing they always look for is thyroid problems, because when someone has a thyroid problem, they start acting differently, and it could be the cause of the behavior. So that's number one. Second one is big advice for families. Families feel strongly they want to fix the problem because they love their family member. And so they think maybe if I can help them remember what the day of the week is or what the date is, it's going to be of value. And it's not really the most helpful thing. It's really better to help them continue physical exercise, cognitive exercise, and keep up with what they like to do. Now, if what they used to do and they did really well can be frustrating because they know that in fact they're not doing it as well as they used to. So some families think, well, maybe I should just not let them do it because they get frustrated. However, it's doing those things at whatever level they can that uses the brain and has it work the best way possible. So whatever your loved one used to do, they can't do it the way they used to, but see if you can help them to do it at what level they can. That's a hard thing to do, but it's an important thing, and it is often why caregivers need help and assistance. Alzheimer's Association has support groups. It's a really good idea to go to those because other people who have been through what you've been through will be able to help you with it. Now, all the dementias are what we call cognitive diseases. They interfere with cognitive processes, calculation, memory, executive function, all this kind of stuff. So it'll be harder to pay the bills, it'll be harder to read the instructions, all of that kind of thing. These are not sensory diseases. People can still experience through their senses. It is so valuable. Whatever music they liked in their life, keep it in their life. I work with a woman on Cape Cod who was a piano teacher. She can't tell you her name. Oftentimes, she can't remember the name of a composer. She can't do anything. We put her in front of the piano 5 times a day, and she sits down and she plays, and it lubricates her brain to some degree, and then she can talk about it. She'll know whether it's Chopin or Gershwin. She didn't before she started, but she'll get going with it. Some of you may have heard of Glenn Campbell. He got Alzheimer's, and just when he was diagnosed, he had a new album, and he went on tour. The doctor was skeptical about letting him go on tour, and he went on tour. It was hard on the family because he didn't want to follow instructions. They'd tell him to stand here, and he'd go over here, and the microphone was there. He couldn't do any of that. But once he started singing, he was himself again. And the doctor at the end of it told the family that he thinks that being on tour like that actually delayed the progress of his disease. So engaging in music and art and other sensory activities, pet therapy, these are things that can really keep someone at the best quality of their life. Next slide. Now, you can't see the picture because you're looking at us, but I'm going to say just a couple words about falls. One of the reasons home is hard for a lot of us is our houses were not designed for safety. It's better to live in a safe environment. And the other thing about a congregate living, whether it be independent, assisted, nursing home, is not just the fact that the environment is more friendly to the human body and will prevent falls, but if you fall, you'll be seen very soon and you won't lay on the floor for a long time. One of the real problems with falls with people who are living by themselves is they fall and they're there for 12, 13 hours, which can cause additional damage. So that's enough of my scare tactics. On to the next slide. So you're on the journey and you've noticed you've gotten older, and we all do. And all of a sudden you need some help with daily living. So you just keep track of how much you need and you try and think about what kind of help do you need? Someone with meals, dressing, whatever it is. Do you have access to support? Now, home care is really great for early stages when people are still managing some things along. I believe, and most of the people that I work with believe that once you've gone beyond 40 hours a week, and that is what you can manage, then you're not going to get as much at home. Most people, even with 24/7, when you think about it, if you can afford 24/7 care brought into your home, which is very expensive, you're getting one person at a time. If you move to a senior living community, not only is someone there 24 hours a day at whatever level you're at, you're getting all different skill sets. Somebody who's cooking your food knows how to cook. Somebody who's helping you dress knows how to do that. Somebody who's cleaning your apartment knows how to clean. We all reach a point where the home care help isn't quite enough and you have to go someplace else. It's different for every person. And it's important that you consider that. And then you would have access to social engagement as well. It's also important to review your financial resources, which we're going to do in a minute. Next slide. And when you think about caregiving, oftentimes we start with our spouse, our children, our friends. But you got to keep this in mind. The burden of caregiving damages the health of the caregiver. And full-time caregivers who work over a period of years, it's physically and emotionally draining. There's a higher incidence of depression, and there is more serious physical health problems and chronic health problems like diabetes and hypertension in caregivers who devote their life to that. Next slide. So we've been talking about, and I've mentioned finance a few times. I'm not a financial advisor. I am a nurse, but I've worked with people on this journey for years and years and years, and I know how to work with financial experts. Next slide. Very first thing you need to do is you need to determine how much you're currently spending. We've got some figures here. These figures are based on average figures in the northern corner of Connecticut. And so people who are living at home on average, and you're not average, no one is average, but it's good for you to figure out what you're spending. People who are living in home on average in the northern corner of Connecticut are spending $2,300 a month in their home. And if they start to need care, and you heard me talk about those 40 hours, and those 40 hours through an agency could be spending somewhere $5,000, $5,400, something along that line. And those two added together are $7,700, which is more than you would spend for an assisted living apartment if you move to Geer. Now, there's different size apartments, and if you want more detail on that, I recommend you contact some of the people and engage in a one-on-one, and you can find out more information. All real estate is priced according to size. So smaller apartments are going to be less than bigger ones, and that's the way it works in any real estate. Next slide. But you might have looked at that figure and you went down and you did the calculations, and when you calculated what you currently are spending and what you currently have available to you, you might say, I can't afford assisted living. Well, there is help for senior housing, particularly assisted living. There is not a subsidy program for the kind of independent living I described, There is some subsidized housing, and Geer is fortunate to have that for independent residents, but it's frequently assisted living residents that need help. Next slide. If you happen to be a veteran or a surviving spouse of a veteran, there's a wonderful program called Aid in Attendance, and it's a pension benefit for people who have assisted living or memory care. And it is a complicated application. It is not something I recommend you do by yourself. There are criteria you have to meet. There isn't an individual cutoff. They look at your income, they look at your assets, and they look at your age and your health status and figure out how long you're going to live. So what we recommend, and this is true throughout the country, do not try and fill out this application by yourself. You can get the name of a good consultant from the people at Geer, and they'll help you fill it out, and they will not charge you. Next slide. And if you qualify, which many people do, it is not like Medicaid. So if you don't qualify for Medicaid, don't assume you cannot get this. Medicaid is a very low cutoff, and it's a straight cutoff. And this is a variable thing. We couldn't even tell you. You can look at a Medicaid application and know how much you make and have a sense. Can't do that with these. And if you qualify, these are the benefits that were the maximum pensions for 2021. They up them every year, but they're quite good. So this might be enough to allow you to move into assisted living. Next slide. The assisted living and the memory care portion of the healthcare part of those do meet the IRS definition of medical expenses. And so you have to take this to your accountant, and they'll compare it to your adjusted gross income and see if you qualify. But there are people where this is just something that can really help them out. And even if you aren't sure about it, just make sure you get that figure and give it to your accountant, because it'll help many people. Next slide. You may have heard about long-term care insurance. If you've already gotten it, good for you. We got ours in our 50s when it was cheaper, and we got a plan that has not increased in cost. It's just increased in our benefit. What I recommend is, whether you have long-term care insurance or you don't have it, talk to your insurance agent about it, because there are new long-term care policies that didn't exist before that are really worth looking at. Some of them are in the form of annuity, some are hybrid, so they're part life and part long-term care. But talk to your insurance agent and get some information, because even if you don't have it, you might be able to get it now. Next slide. Many of us have paid up life insurance. If we had a family, we probably took out a life insurance policy to make sure we had something for the kids in case anything happened to us. They would not be stranded. And now we don't need it anymore. They're grown up and they're making their own salaries. They're taking care of themselves. Talk to your life insurance agent about that, because sometimes you can just turn the policy over. Sometimes you can turn it into an annuity. Sometimes you can use part of the paid up funds to pay for your long-term care insurance. I don't want you to do it just based on this slide. I want you to make sure you meet with your insurance agent and find out what things are available. So there's a lot of homework you have to do that is financial. So you make sure you're moving in a place where it matches your budget. Next slide. Last thing I was asked to talk about was how to talk to your loved one about these health and safety concerns. I can't tell you how many people I've talked to over the years that say, I haven't told mom or dad that we're thinking about this, or I don't talk to them about driving because they don't want to talk about it. It's not a single conversation. In your lifetime, can you think about something you were hesitant about, where one single conversation was able to convince you because people used the right words? It's not that. You do have to be honest about what you're saying, and you have to be open, but it involves multiple conversations. It's a marathon, not a sprint. It also involves experience. So what I recommend is that once you decide that someone should consider other living options, visit. Go see the communities, have a meal, go to an activity, go to whatever communities are around there, and experience it. That is what gives people the aha moment. Maybe this wouldn't be so bad. So do it over again, and it's the way to do it. Next slide. We didn't know what we were getting in for, but we may as well make the most of it. And as I say, we should dance in whatever way we can. Next slide. The goal is finding the best home for the best time and being happy there. Thank you very much for your time. I'm going to turn it over to our team from Geer, and I'll be available for questions after.
Hi there, welcome everyone. My name is Deb Pelletier. I am the admissions transition specialist here at Geer Village. Joan, thank you very much. Joan spoke a lot about all of the different levels of care that we have here at Geer Village, which is, what we do. So in speaking, and you can switch the frame, I'm sorry. Perfect. So what we do here is we focus on exactly what Joan said. A lot of cognitive care, a lot of physical exercise, activity, many programs. We use music therapy, pet therapy. We use all resources, and we have a great recreation team, as well as a great wellness team. And our clinical team is right there. So with all of these specialists here in the building, it's absolutely amazing that, we are able to provide all of these services for everybody. Go ahead and flip, please. Thank you. So we focus on what matters, which is family, friends, and neighbors. Joan, I know that you spent a lot of time, with memory care in this particular instance, which is great. It's a big focus of what we do here at Geer Village. We very often work together. So as the transition specialist, I work with our clinical team, physical therapists and occupational therapists, recreation. We see where people are. And most definitely the socialization piece is a big piece. So we just keep everybody included. We make sure that our families and residents are all included in what we do here. Go ahead and flip. So again, Joan did cover the fact that we do have our independent living apartments, assisted living, memory care. We did create an enhanced care unit, which is the highest level of assisted living, but not quite ready for our nursing home. So it could be a one assist. It could be someone that needs a little extra care. We have some residents that being in garden side, and they've gotten further along in their disease, and it's overstimulating for them, which is not good either. So again, together as a team, we decide and discuss and have the family involved that, the best place for your loved one would be in this area here. The outpatient physical therapy is a big piece. Charlie from our pharmacy services, speaks to residents and families all the time, and is able to be right on site and answer many questions. Dial-A-Ride, so we provide transportation for our Geer residents. Not just rides to appointments and stuff like that, but we do have many activities that we have. We do also provide transportation for the northwest corner of Connecticut. The other piece that we have on our campus is our subsidized housing, which is the Beckley House. So they're able to use our services and, possibly transition to skilled nursing when that time comes. Having this building here with the YMCA, this gorgeous campus, many activity rooms. We do try to provide many community gatherings for our folks and, provide informational things as well as fun things to do. Go ahead, Beth, and skip. Thank you. I just want to also touch on, we want you to live as independently as possible. Sometimes, unfortunately, there does come a time when, like Joan stressed, the socialization and the exercise is critical especially in memory care, to keep that body going and keep that mind going. We don't take transitions lightly. We certainly work together. Very often, we're very lucky to have all of the levels of care that we have. We've had spouses where we've been able to let that person just be the husband or wife again and transition their loved one to memory care, where they do get the exercise that they need throughout the day, and also, most importantly, the socialization that they need. Isolation is definitely a bad thing at that point, so we don't like to see that. And again, it's a team of people that provide that exercise and socialization and what's best for our residents. You can go ahead and flip. Again, I've already touched on the transportation, which is a great piece here. We do have Chrissy Bafanis that's here that offers, upon admission, a free assessment to our residents. She goes through and sees what physical, occupational, speech therapy, encourages folks to social activities. She will see what people can and cannot do, and again, relays it to this transitions piece. Along with myself and the clinical team, we provide all of the information where someone is, we want them to be capable of doing what they can do on their own. And sometimes they do need that extra care, and that memory care is just the right place to be. And then, of course, the pharmacy and medication management. We've got Charlie here. So we have our medication delivered to our independent residences right up to their mailboxes. If they have any questions, they can certainly call him and speak to him. And again, our nurses in assisted living, enhanced care, and memory care receive all of the medications directly from Charlie, and we provide the medication management that is overseen by our nurses. Go ahead and flip. That may be it. Yep, that's it. So I would just like to say, please come on in for a one-on-one tour. Give me a call with any specific questions pertaining to Geer, anything at all that I can help you with. Certainly, again, we are here to help you, show you what we have, and we're very proud of our campus. Thank you very much for joining, everyone. Joan, thank you.
Thanks, Deb.
Now, if we do have just a couple brief moments, if there are any questions that we had from our audience, if there's any questions that you'd like to ask our presenters. Let me see here. Deb, is there priority access for the skilled nursing if you're part of the senior living community?
That is correct. So as far as, inpatient rehab, there's priority, and there's also priority for transitioning to our campus. There are times, especially during this COVID crisis area, where a transition is not possible, possibly for an outbreak or something. We don't kick our people out. We have them, we're here, we take care of them. And when that transition is capable of being done safely and appropriately, it certainly gets done. But we take care of our residents right through the whole cycle. So from the assisted living, memory care, enhanced, to our skilled nursing facility.
Very nice, thank you, Deb. Okay, well, actually, that is all the time that we have for our webinar today. If there are any other additional questions, please feel free to contact Deb or Dr. Roach, and we'll be able to get back to you. When we send out the recording, we might be able to answer some questions as well. So on behalf of our presenters, Dr. Roach and Deb Pelletier, thank you for joining us, and have a great day.